joining us, especially under the difficult circumstances that we're seeing right now across the state with the hurricane. It's a very important topic today. We're here to talk about healthcare and how Donald Trump has failed on healthcare time and time again. He is leading the charge to repeal Obamacare in the middle of the pandemic. There are millions of Texans that are uninsured right now. Texas has the highest uninsured rate in the country. And Donald Trump has put our entire healthcare system into crisis. So joining us today are Sima Ladjevardian, the candidate against Dan Crenshaw, who's running into Texas's 2nd district. We have Michelle Beebe, sorry about that, Michelle, who is a nurse from El Paso. She was featured last week at the Democratic National Convention. We have Robert Lopez, who was a firefighter in Mission, and he was also featured at the Democratic Convention. We have Representative Armando Martinez, one of the best representatives that we have on the Democratic side. And then we have Eddie Olivares, who is the Health and Human Services Commissioner of Hidalgo County. So what we're going to do here is let each of them speak. Then we're going to have a quick question and answer section where you type in your question to the question and answer box, and we'll relay them on a first come, first served basis. With that being said, I will let Sima kick it off. Sima?
Thanks so much for having me here today. I think it's such an important time right now. And, in Houston, of course, with the hurricane coming, I came to this beautiful country fleeing chaos and revolution, and had a shot at this American dream that gave me a chance to succeed and also helped me while I was going through my cancer. I was lucky that I had insurance. My cancer was detected early. I was given the best treatments to survive, and I could afford the prescription drug prices, And I really decided to run because, this American dream is in jeopardy. And I saw Crenshaw running on his platform of lowering prescription drug prices, going to DC, just getting money, voting against it, and scrubbing it off his website. And I knew then that he was going to work for the swamp. And, healthcare is very personal to me. High quality healthcare is very important and is a human right. And the fact that we live in a state that is the least covered state in the nation, before the pandemic, it was 1 out of 5, and now it's 1 out of 3. We had more than 176,000 Americans died, and here in Texas, around more than 11,000. And Trump and his enablers like Trump have put out this information, listened to experts, helped to keep people safe, call this virus a hoax, call all this fear-mongering, while really refusing to wear masks and holding in-person events. And they all pushed to open the state too early at a cost of more death and more unemployment. Crenshaw, like Trump, he signed on the lawsuit to dismantle the ACA in the middle of this pandemic, not once but twice. We have more than 24 million Americans, 2 million Texans who can lose their health insurance. And then we have 10.7 million people like me with pre-existing condition who could lose that protection. And I think, he's being rewarded for his unwavering loyalty, and he gets to speak tonight at the Republican convention. I just think, healthcare being a human right, we have to make sure that we open our enrollment, stand behind our, Vice President Biden, make sure that we do have healthcare for everyone in the middle of this virus. And the cost of Trump and his enablers and the chaos that is being created is just, it can't be more clear. So many families have lost loved ones. And I know what that means. I lost my grandmother to cancer also. And I know somebody else who really understands loss, and that's Joe. Joe and Kamala will stop this chaos that Trump and his enablers have just plunged us in. And this is an existential. Our democracy, our American dream is in jeopardy. And we need someone like Joe and Kamala to make sure that we build on Obamacare. We can't tear down all this, lower prescription drug prices, and then come up with a no-cost COVID vaccine that we're able for everybody to go back to their lives. With less than 70 days to go, we need to make every one of them count. So please make sure you get involved. You text United to 30330 to get involved. We have no other choice, and we have to protect our families and stand up for them. Thank you for having me here today.
Thank you very much, Sima. Those are some great points. There are 10.7 million Texans who have pre-existing conditions who stand to lose coverage if Trump is successful. We're now going to pass this over to Michelle Beebe to talk a little bit more about her personal experience with healthcare and why she believes Joe Biden is the best choice here for healthcare to stop the chaos that the Trump administration has brought to our healthcare system. Michelle.
Thank you. Thank you. I do believe that Joe Biden is the best candidate because he believes in the science, and he is telling us that, we need to wear our masks and we need to social distance to protect ourselves and to protect our families. And that's something that I said there at the DNC. I think that is our main focus. We are all in this together, and we need to protect our families and our students and our kids and our faculty. Everyone needs to do their part. When I saw the RNC the other night, unfortunately, I didn't see a lot of people wearing masks or social distancing. And for me, that was kind of scary. I really don't get sick and go back home and, give it to their families. Unfortunately, we have had all these deaths here right now. And, for every family that is affected, with one death, the whole family is the one who takes it with the suffering. And so that's something that I think that we don't realize, that it affects every single person. And right now, I know that one of our biggest concerns is our personal protective equipment. I know that he said that we have a lot, but unfortunately, it is limited. And with face-to-face instruction coming, that's one of our concerns right now.
Yeah, those are some great points, Michelle. We're now going to pass this over to State Representative Armando Martinez.
Hello and good afternoon, everybody. Pleasure to be here, and thanks for the invite. Let me tell you that there is no reason not to believe and no denying that Texas has the highest uninsured population in the nation. And when you actually look at the estimates that show that about 1.6 million Texans are uninsured after losing their jobs due to this pandemic, we know that it starts from the top. I mean, it's undeniably obvious that the Trump administration has failed the public and not only the nation, but the people in Texas and in Deep South Texas. That's about 20% or 328,000 people that could qualify for Medicaid if we had expanded Medicaid in the state of Texas. And but the reluctance of the powers that be and those that are in power right now not to do that has really impacted people here in the state of Texas, and it's a travesty. If you look at Hidalgo, which you're going to hear from one of the people that I admire, one of the most, Mr. Eddie Olivares, who's our Director of Health and Human Services here in Hidalgo County. You're going to be able to see the growth in the numbers and the amount of deaths and the people that have been impacted by it. And it's time to change that. I'm a firefighter, I'm a paramedic. I've been doing that for over 20 years. And I know I have one of my brothers here that I'm very proud to share the stage with, and Robert Lopez from Mission. But let me tell you that, people always call your firefighters. This is not about a political thing. This is not about political affiliations when you're talking about lives. This is about humanity, and this is about responding to the issues that affect people daily in this nation. As a firefighter, when somebody dials 911 and they call us to their home, or as a paramedic, we get there and it's not about the color of your skin. It's not about how much money you have in your pocket. It's about providing a service so that we can get you to definitive care, so that we can help you and make sure that you aren't injured or sick or hurt. And we're doing our job. The issue here is that the American people have dialed 911 and Donald Trump has hung up the phone on them. And we have not had a response. This is all about political affiliations. And you can ask whoever you want about how the response has been here in Texas. And depending on who you ask, that's the answer you're going to get. But I can surely tell you, with the amount of infections that we've had, the amount of deaths that we've had, the amount of impacts that we've had, not only in Texas and in Deep South Texas, where I'm from, and these concerns are apart, this Trump administration has failed us, it has failed Texas, and it has failed the United States of America. And it is definitely time for a change and for us to support Biden and Harris so that we can get this country back on track, so that people can feel that if they pick up that phone and dial 911 in a pandemic, that we have a president who's going to care in Joe Biden. We have somebody that's going to pick up the phone and that's going to do something about it, not call it a hoax, not say that it's a political issue and that it's only a political party that's causing this. This is about people. This is about humanity. This is about our future. And this is about the United States of America. And it's time that we make a change and that we select somebody who's going to make a difference. And that's Joe Biden and Kamala Harris.
Very well said. We're now going to pass this over to Robert Lopez, a firefighter from Mission, who also is featured at the Democratic National Convention.
Good afternoon. Thank you for having me. I'm going to echo a lot of things Representative Martinez said. Being here in South Texas, we've seen this whole pandemic just escalate from the very beginning. I can remember we're out South Padre Island spring break running our mobile hospital, and we were hearing about 1, 2, 3 cases, and then just fast forward a couple of weeks, and it snowballed. And now we're one of the hottest spots in the country, let alone the state. We're surpassing, I saw an article the other day, we surpassed the city of Houston in deaths for one of the days. And our population compared to them is just crazy. And prayers to Houston right now with that storm going that way. But it's just seeing, this is something we've never dealt with. It's just different. Like Representative Martinez said, when they call 911, they're asking for help. It doesn't matter color, race, party affiliation, nothing like that. They need someone they call us on the worst days. At the beginning, it was kind of scarce with very limited PPE. Luckily, we've been able to grab some, but it got kind of scary for a while when seeing hospitals inundated, seeing ambulance companies with an hour, 2-hour response because they have nowhere to send their patients. Going to patients' houses and them being scared of being transported just because, oh, I don't have insurance. Oh, I don't want to pay for it. And I mean, you can tell they're very, very ill, and convincing them, you know what, you need to get some care. Worry about how to pay for it later. Let's get you to the hospital. Let's get you taken care of. And that's us doing our job. The other thing is bringing this back home. I have a 5-year-old, almost 5-year-old. I would, heaven forbid, she would get sick. She's about to start school online. Her mom's a respiratory therapist dealing with COVID on the daily. So that's one of our biggest fears is bringing this back home. And I share that with all my membership. We've had several members in our department test positive COVID. Luckily, none are serious. But unfortunately, 2 days ago, we lost one of our brothers in blue of Mission PD. And I mean, to hear that they're saying this is a hoax, it's fake, no mask, social distancing, until it hits home, until it hits one of their family members, that's when they're really going to take this serious. And that's the sad part. And we need to get past this.
Thank you very much, Robert. We're now going to pass this to Eddie Olivares. I saw him on. He might have hopped off. Let's see if he's able to hop back on. Eddie, you here? All right. Well, if he hops back on, we will go to him. We're now going to do a question and answer section. If you have any questions for any of the speakers, you're going to type it into the messaging box, and I will get to them on a first come, first served basis. So yeah, if you have any questions, just start to type them in right now. Okay, first question. Texas was recently hit with Hurricane Hannah and is now preparing for Hurricane Laura, but it's been a site where COVID-19 has surged. What have been your observations of Latinos that have been affected by both hurricanes in these communities? Representative Martinez, do you want to take that one?
Absolutely. And let me tell you, according to a summary of the National Data by Congressional Budget Office, okay, and this was back in May of 2020, people in families with an income of below 200% of the poverty level, which is mainly your minorities, have been impacted the most. These are families which adults have to work either part-time, full-time, they've lost their jobs. So when you couple the impact of a pandemic and then you add the issues with a hurricane and people not being able to go work, it's going to affect them financially. They're not going to be able to pay rent. They're not going to be able to pay their vehicle, their bills. And most importantly, even access to food and healthcare, which is the most important thing for a lot of people. So if you actually look at the minority base, we are the ones that are being affected the most by both Hurricane Hannah and of course our pandemic. And a lot of this could have been avoided. And I'm not talking so much about the natural disaster because we know that those happen and a lot of times we prepare for those. But in terms of a pandemic, if this would have been taken seriously, if opening Texas would have taken a little bit longer, just a little bit longer, than trying to open it up on Memorial Day. I think you would see less of infections. I think people would have taken it a lot more serious, and then we could have gotten back to business normally and have some type of normalcy if we would have just taken it slow instead of it being forced on us by an administration that refuses to look at the numbers, that refuses to identify the impacts that it has on minorities. So if you couple both of these types of issues, a pandemic and a hurricane, it's a recipe for disaster. And the ones that get affected the most are the minorities, not only in Texas, but across the nation.
Great. The next question is for Sima. It is, Dan Crenshaw is looked at as a rising star in the Republican Party. What makes you believe that you can beat him? I think you're muted.
Sorry, we got it right now.
Yep.
Look, Dan Crenshaw went to DC and broke a bunch of his promises, one of them being lowering the prescription drug prices, and has been trying to gut our healthcare throughout this pandemic and has been just spewing lies and disinformation, not caring about what anybody in this district is feeling and just pandering to our president. And that is why he's being rewarded for being on tonight. I think the people of this district are hurting. They need somebody who stands up and who cares for them. And that's not something that he's been doing at all. So this is what I'm standing for. And I know we can do this together.
Great. All right. Remember, if anybody has any questions, type it into the chat box right now. Okay, next question is also for Sima. You were recently named a target of the DCCC. Can you describe some of their investments in your race and how the investments are going to play moving forward?
And I'm very proud to be on the DCCC's list because I think it's very clear that this is a winnable district. You know, Beto just lost it by 3,000 votes. It is very gerrymandered, but it's clearly everybody wants better healthcare, and they understand that their elected official Crenshaw has just left them behind, and all he cares about is his public image. So this is really what we're looking at, making sure we put the messaging out to show that I am the person who's going to fight for healthcare, being a cancer survivor, being an immigrant who came to this country, that I was given all the opportunities that were given to me, and that dream is in jeopardy, and that's what I'm going to fight for. And, that's what we're going to do in this district.
Great. Next question is, nearly 30% of Latinos in Texas don't have health insurance. How do we make sure that we're not just expanding options for people who already have health insurance, but properly conducting outreach to those who do not? Anybody want to take that?
Sure.
Okay.
Go ahead, Sima.
No, go ahead, Doctor.
Go ahead. I was just going to ask you to repeat that question just one more time.
Yes. So nearly 30% of Latinos in Texas don't have health insurance. How do we make sure that we're not just expanding options for people who do have health insurance, but properly conducting the outreach to those communities that do not?
Well, I think, first of all, I want to tell you that it's all about access to healthcare and properly educating the public and providing those services. The only way you can have a service is by providing the services. And I believe that Texas and the legislature and those that are in power have failed a lot of Texans, because if you look at the fact that we have refused, or the state of Texas and the powers that be have refused to expand Medicaid, that healthcare coverage gap has become so severe in Texas that, with a study released from last year from the University of Michigan, estimated that 730 Texans die each year because state leaders refuse to expand Medicaid. And that's access, access to healthcare, which is extremely important. And that's people that have pre-existing conditions that could also be covered if we would have not only expanded Medicare, but allowed for the Affordable Care Act to be implemented here in Texas. So many people talk about our premiums are so high. Well, the only reason your premiums have not dropped in the state of Texas is because we have not expanded Medicare. We have not implemented the Affordable Care Act here in Texas. Therefore, your premiums are not going to go down. And I applaud Sima, and I thank you very much for being here, and you have my full support and my endorsements. Sima, I'm telling you today as a state representative for District 39, we're going to make sure that you're successful as well, because it is people like you that are the epitome and the very fabric of this nation that can help make a change, that can be a voice and speak up for people that are out there that need the help, that need the services, and need the healthcare that's important for them, not only to be successful in life, but also to be healthy and to have that coverage. As the state that always we tout ourselves as being everything's always bigger in Texas. Well, you're right when you have the largest uninsured population. You're right when you're ranked the lowest in education. And we need to change that, and it's time to change that. And the only way we do that is by turning Texas blue and electing people like Sima into Congress, and also changing the way and the direction of our nation by electing Joe Biden and Kamala Harris.
Yeah, leads perfectly into the next question here. This is for everybody too. Do you believe Joe Biden can win the state of Texas, and why?
I absolutely believe Joe Biden can win the state of Texas. I think the numbers are very clear. Beto came by literally just 200,000 votes. People are all fired up, and they want somebody who represents them, who cares, who fights for healthcare. As a representative was saying, our communities of colors have been touched by this virus more than anybody else. We have 40% of our population that is Latino, and it's 60% of the uncovered by healthcare in this. And it's just, we have to address this issue. And Joe Biden understands that we have to expand affordable healthcare, ACA, and then make sure that we help everybody who's hurting. And it's very clear, our numbers are close, and all the polling shows that they're neck to neck, and we're going to win this together.
Great. Anybody else want to take it?
Yes, I believe that Joe Biden is going to win this because, again, he's listening to the science. He's telling us that right now maybe it's not the best time for our kids to come back. He's telling us we can only come back when it is safe for us to come back. And I think that's one of the biggest points with all these parents. I know that it's a struggle. It's like having two jobs. You go to work and then you have to go home and help your kiddos. But you know what? We have to think of everybody's health and safety first. And I know that's what Joe Biden is about.
Great.
Yeah, I'll say the same. When it comes to first responders, Vice President Biden has a long track record of supporting firefighters, supporting first responders. That is the reason that IFF was one of the first or the first union to endorse Vice President Biden. He just has a track record. You put them both on paper, it's comparing apples to oranges. Hands down, that's why we support him. We support those who support us, and by all means, Joe Biden has the support of most firefighters in the country.
That's great. Representative Martinez, do you want to take it too?
Absolutely. I can definitely say that I know Joe Biden can win Texas, but it's about all of us working together to make sure that it's happened. We need to take a different direction in Texas and in our nation, and we need somebody that's going to provide us with that direction. Somebody that's stable, somebody that understands, and somebody that can make a difference. And I know Joe Biden can do that. Let me tell you, my wife is a fourth grade writing teacher, and everybody from the top can always tell someone else how to do something, but it's not until you're in the classroom, it's not until you're experiencing what we're experiencing as first responders. And Robert, you know exactly what I'm talking about. It's not until you know those people who are in the trenches, our doctors, our nurses, and what they're experiencing, that you can actually say what it's like. And we know that somebody like Joe Biden and Joe Biden himself listens, understands, is compassionate, and it's about humanity at the end of the day. And he will make the right decision, and he will win Texas.
Great. Do we have any other questions? If you have a question, type it into the question box right now, and we'll get to it. All right, let's go to closing thoughts then. Sima, do you want to say any more closing thoughts?
I think, we all know that this is the existential time of all of our lives. It's the most important election of all of our lifetime. And people like Trump, who have just taken all these wrong decisions and hurt, with taking healthcare away, enablers like Crenshaw, it's time for them to go. And we have to make sure that everybody goes out to vote early. As we all know, they're trying to do whatever they want with the post office in the middle of this crisis, even though, our veterans are not getting the medication they need. And it's very important to make sure that everybody goes and votes and then supports our incredible nominee, Joe Biden and Kamala, for this.
Thank you. Michelle?
Yes, I would just like to share a proverb that my 95-year-old granny tells me. She always said, an ounce of prevention is worth a pound of cure. It's easier to stop something from happening or getting worse in the first place than to repair all the damage after it's happened. And unfortunately, Americans had to pay their lives with this at this time. So it is definitely time for change. It's time for Biden to step up and get to be president.
Perfect. And Representative Martinez?
Absolutely. And let me just tell you that I applaud everybody that's here today. And we need to continue the momentum. We need to continue to get the word out. We need to continue to support our candidates in each and every one of their districts and in each of their elections that they're running for. And I think it's imperative on us to make sure that people get out and vote. The only way we change things is by changing the mentality of going out there and vote, and knowing and people understanding that their voice is their vote and it does make a difference. And the only way we'll change the direction of this country and make Joe Biden our president is by making sure our people go out and vote. And we need to do that. So with that, thank you very much. May God bless you. May God bless Texas. And may God bless America.
Thank you. And Robert?
Just same as that. All this work, all this effort doesn't mean anything. We can't get our friends and families to go out there and vote. Our country is so separated right now. I believe Joe Biden is the one to unify us. He's the one that can help us get through this pandemic. And again, we can't reiterate how much we need everyone to go out there and vote.
That's perfect. Well, if you have any more questions for any of the speakers, please email me at abhi@txdemocrats.org. Again, that's abhi@txdemocrats.org, and I'll get the questions over to the speakers, have them answer it for you. Besides that, thank you all for joining us, and I hope you have a great rest of your afternoon. Thank you.